Megan Fox has the story.
Megan Fox.
Megan Fox.
Megan Fox.
Megan Fox. Megan Fox, a national journalist.
Mastodon. I will never be able to say that.
It feels like the Flintstones live there.
It does.
Well, don't trust women. I think you just touched on that with your last. That's what they brought. We're going to have to bring back chaperones.
Jesus, no.
Just careful. Stop! Right. Ooh. Hard right.
How did you screw up a stove, Megan? You're a woman. I thought that was baked into you, like at the genetic level, how to operate kitchen equipment.
And honestly, Megan, if you don't like it, I'm sorry. I've been very nice to you.
You get Dino hanging out outside chewing on a large bone. I highly recommend being targeted by the New York Times and Rolling Stone for weight loss. And I'd say, keep it coming. I need to lose 20 more. Please, keep it coming.
Explain to me, Megan, why did this country not have a holiday once a year? That's the time you vote. If you don't show up and vote, up your ass. You don't get another chance. You don't get, I don't care if you're in the hospital. Crawl to the stake, crawl there. But that's it, 1 day, 12 hours, and then you're done. And you count them that day, and that night you know who the hell won.
I will eat you alive. You want to tangle? You want to go?
The only thing going through my head is, what are you going to do when Megan Fox runs wild on you, brother?
He made a deal with the devil. She's the devil.
He wants that.
Oh, God. Gross! Oh! All right, penalty box for slug. Yep.
Of a mile.
Are you ready to behave yourself now, slug?
This frustrating rep.
Are you ready to behave yourself? Repossessed puppies. I'm hiding pork chop. ASAP. Have you seen his little pork chop? Oh my God, pork chop is the cutest.
That sounds bad.
Have you seen it?
Pork. It's pork.
Though you may be tempted, do not contact any person or persons mentioned on this stream. Do not even think about contacting anyone who may be the topic of the daily news. If you should do that, the host will question your IQ, possibly call you names, and mock you for disobeying these basic rules of decency.
All the best.
Good morning, everyone. It's me, Megan Fox, coming to you live from my dining room. Mr. Fox is sick, so my studio, which is also our bedroom, I had to move everything so that I could actually keep working, because poor guy, he hasn't gotten out of bed in, what are we going on, 3 days now? So it might sound a little weird. I know it looks a little weird, but our Legos are up here behind us, for our Valentine's Day Legos. So anyway, we are here today to watch, let's see, do I have a banner for it? The Massachusetts v. Woodward retro trial. This was from 1997. And Jeff from Legal Vices had started watching this with you guys, and he really wanted you to see it. And so let me make a banner so people who come in here late will understand what we're doing. Watching Massachusetts v. Woodward from 1997. And Jeff really loved Barry Scheck, and he's we are in the middle of his cross-examination of a doctor who looks a lot like young Dr. Lipsmacker. Who was that guy from the Depp trial? The one, that guy? He looks like he could be a young, that guy. I can't remember his name now. Retro trial. No spoilers. Okay. There. Now I can put up the banner. There we go. All right. Spiegel. Yes, Dr. Spiegel. Yes. And yes, I did disconnect TugStream last night early on accident as I was trying to leave. I hit the wrong button. Let's see. All right, Dr. Kenneth Mandy is on the stand, and he's the one that looks like a young Dr. Spiegel. And Barry Schenk is in the middle of his cross-examination. We left off at 53 minutes, and I actually got the timestamp this time. I don't have a bingo card for you today. I mean, I don't know. There was a lot going on. There's been sickness. There's been all kinds of stuff. So maybe I'll make one while we're watching this. But here we go. We are going to keep a special eye out for screams in Boston because the prosecutor is so Boston. And we've got all kinds of late 80s and early 90s fashion, shoulder pads, Dorothy Hamill haircut, all kinds of things to laugh at this one. But this case is very sad. It's about the death of a 9-month-old baby. And the prosecution wants us to believe that this young woman over here, Louise Woodward, the nanny, shook the baby to death. And the defense is saying, yeah, we're not sure about that. And of course, we find out many years later that shaken baby syndrome is basically non-existent. It's not a thing. But lots of people went to jail for it. In fact, Sally Smith, Dr. Sally Smith, the child abuse pediatrician in the Kowalski case, sent a couple of people to jail for that. And the weird Kowalski connection in this case is that Dr. Neuberger, who was the child abuse expert for the Kowalskis, he testifies in this case for the prosecution. And I think he's the one that said if he knew what he knows now, then, if he had known what he knows now, then he would have testified differently. Scary, right? Okay, here we go. Let me make sure the volume is good.
You indicated before that Dr. Deborah Epen and her husband, Dr. Should you refer to his son or Sunil?
I only know him as a professional.
Sunil Epen came to the emergency room.
Weird.
That afternoon.
The volume booster is not working. Why? Huh.
Yes.
And you have indicated that you knew they were both physicians.
Yes.
And you knew they were both affiliated. Well, let's put it this way. Did you know that they were affiliated with hospitals in this area?
I knew that Mr. Eastman had worked at the Brigham because he came, I believe, directly from there.
And had you ever met him before?
Not to my knowledge.
During the course of that afternoon, were there other medical colleagues of yours who came into the emergency room that afternoon who knew him and knew you?
Were there other medical colleagues that knew him?
Yes, and knew you.
Well, certainly there were you mean medical colleagues not from my department?
Yeah.
Not that I was aware of.
You know Dr. Pasucci,
Oh, yeah.
anesthesiologist.
Right.
And Dr. Sunil Epen is also an anesthesiologist.
Doesn't he look like young Dr. Spiegel? It's so weird. He really could be. I miss Jeff too. I do. I miss Jeff too. I know you guys do. I know I'm not the same. I know. I know I couldn't possibly fill those shoes. I am going to set a super chat goal because Jeff would want me to, because he was better at grifting than me. So I'm going to set a goal for 10 super chats of any colors in 30 minutes, and I won't turn on commercials. How about that? That way it'll help me keep the stream from having to be monetized. I hate having commercials in live streams, you know? So if we can do 10 in the next 30, I won't have to turn it on. And I just want to say thank you to all of you who are here right now. Please like the stream and subscribe. Help the algorithm out and make sure that you share it with your friends because I am early today and I bet people were not expecting me to be Although I did put it up yesterday to give you guys notice that I would be doing this at 8:30. All right. Where did my thing go? Here it is. My volume booster is not working, so I will just try to be very quiet.
He was there,
in
right?
the emergency room.
Okay, yes.
And he knows you? You work with him?
I've worked with him when I was, we continue to work together on cases that involve the intensive care unit and the emergency room.
You've been doing that for some time?
Yes.
And you realized that afternoon that Dr. Pasucci was also a friend of Dr. Sunil?
I may have. I didn't focus on it if I knew that at the time.
But you knew that afternoon that you were dealing with a situation where two doctors, one of whom at least was a friend of your friends or a friend of your colleagues, had this in the emergency room, and their child was the one that was in this distress state.
Well, since I don't think I knew that Dr. Pascucci knew Dr. Epen, I don't think that I was aware of this relationship at the time.
Let me try it this way, Dr. Mandel. When both Deborah Epen, Dr. Deborah Epen, and Dr. Sunil Epen arrived, they were both doctors. You knew that.
That I knew.
And you knew that they were doctors in, let's say, the community of people that are involved in the Harvard teaching hospitals. You knew that.
I didn't know that Mrs. Epen, I'm not sure what her affiliation is.
But you knew that of the father.
I knew that of the father. He came over from the Brigham.
And would it be a fair statement, Doctor, that when you're withdrawing? Now, one of the things that you did almost immediately, based on, as I think you've indicated, the finding of the retinal hemorrhages, is you immediately made this what's known as a Section 51A case.
That's my legal application, yes.
Okay, let's explain that to the jury. Section 51A means a presumption of child abuse.
It's, in this case, if there's any evidence of abuse or neglect of a child, we file on behalf of the child with the state. I'm a mandated reporter.
Okay, so I think it's interesting. I don't know if you caught that. Right before he started asking about what is a 51A case, he asked him about the relationships that the Epens had with people at the hospital, because the Epens were both doctors. So Mr. and Mrs., if I got that correct, did he say both parents were doctors? So right away, you've got like this incestuous relationship between the Epens and the hospital. So if they were going to open up a child abuse case, would they be more willing, the hospital, more willing to go after to indicate the parents for it, or the nanny? Well, if they knew the Epens, that would be a bias, right? That's definitely something that would raise big question marks. Both parents are doctors at the same hospital. Oh my God. Yeah, that's a conflict. You know what? I just realized Archie Ruckus is locked in his room because his feet were drying. Let me go get him, and I'll be right back. Hey, buddy. Yeah, the thing about being downstairs is that the dog can be in here with me. He doesn't go upstairs. Come here, buddy. Come. Why are you being weird? Come here. He's camera shy. Come here. Come here. Come here. Why are you being weird? Why is your head hanging down? What are you doing? Get your head up here. He won't put his head up. Are you not feeling good? What's wrong? What's wrong? What's wrong? Put your head over here. He's acting really weird. He doesn't want to be on the camera. Are you okay? Oh, he was sleeping. He's moving very slow. Sorry, can't see him. And the camera's not in the right spot. Jeez, what is going on with you? Come here. Why are you walking like that? He's walking weird. But German Shepherds always walk weird, so I can't tell you if it's like a problem or if it's just his back legs being weird. Because when he's tired, he acts like he can't walk. But I think he can. I think oh geez, he's got his head he pushes his head into my lap. You're a good boy. He's so big. I guess I should try and get the camera so you could see him. Now he's waking up. What? What do you want? Yeah, I know. Now he's going to bug me. I shouldn't have done that. I should have let him sleep. Let sleeping dogs lie.
So
Just make sure you're in section 51A refers to the section of the statute. Is that correct, Dr. I'm sorry. Doctor has testified.
Why are they whispering? Oh, it's the judge. Speaking in the microphone, sir.
You refer to yourself as a mandated reporter.
There are several groups of professionals, doctors, teachers, social workers, who, if they encounter a child who may have been abused or neglected, is obligated to report that to the state, legally obligated. And so in a routine fashion, we filed a 51A. We call it filing a 51A, which means a phone call to the Department of Social Services by our social worker and a form that we fill out.
So as soon as that 51A mandatory reporting is done, that triggers a whole investigation that involves various different people in the hospital.
There are a couple people in the hospital involved. There's the emergency department social worker, and that social worker, and again, I'm not sure what happened in this case, but generally would consult with a member of the child protection team. We have a team that deals with these situations. Those would be the two people I would know would be involved.
The child protection team, that's Dr. Newberger's.
I believe Dr. Newberger runs that team.
Now, what I'm getting at, though, Doctor, is that when you are involved in making your mandatory report in a Section 51A situation, in any situation, whether it's doctors or not, sometimes for a person in your position, the emergency room pediatrician, this is an awkward situation. Yes. No.
It can be awkward.
And in this instance, would it be fair to say that since you knew this was a child abuse investigation, mandatory report was being filed, and the individuals who were the parents were both physicians, that made it just a little bit uncomfortable and awkward for you?
I wouldn't say that I experienced it that way. No.
Lies.
Well, do you feel that when you're a doctor involved in a child abuse or 51A situation, and the parents are other doctors, that there is a danger of perhaps losing a little objectivity, a danger of it? Not saying you did, I'm just saying a danger of it.
Hypothetically, I think more so if I knew the people.
But you knew they were doctors.
Working where I do, a lot of my patients are the children of doctors, so I do get used to it.
And would it be fair to say that you wanted to avoid the danger, because medical colleagues were involved, of making any snap judgments about what was going on?
Well, it wasn't my job to make a judgment. It was just my job to report the findings to the state. So I wasn't concerned about this. It was a fairly automatic process.
All right. And were you concerned that there might be a danger because other doctors were involved, that the usual procedures would not be followed?
No.
Well, doctor, don't you consider it a troubling delay that this child presented in the emergency room to you at 4:10 and a CT scan wasn't performed until 5:23?
That seems adequate to me given the case.
That's about an hour and 13 minutes, or an hour and 12 if it's 4:11.
In our initial assessment of the child, the differential diagnosis was broad, And one of the reasons that we didn't go to the reasoning behind the primary survey, but the primary survey is done to assure that we are in control of the vital functions of the child. If I send a child up to the CT scanner who's not breathing, then we're not really doing our job. Okay. So the first part of the visit was, as is routine, dedicated to vital functions, airway, breathing, and circulation.
So what did happen here, just to be clear, is that you did an ophthalmology exam.
That's correct.
Then you brought in Dr. Diamante to do an ophthalmology exam.
There was no delay as a result of these exams.
I didn't ask you that.
I did
I
those.
only asked you, did he then come in and do an ophthalmology exam? And then Dr. Deborah Epen was permitted, and I think you explained to us why you did it, but she was permitted to do an ophthalmology exam.
That's true.
And that's not something you ordinarily do. You wouldn't wait for that, but you decided to do it in this case because, after all, she was a doctor.
When you say wait, that gets back to what I was trying to say. There was no delay as a basis of as a cause of it.
But those events did happen just as we've described them.
Yes, but we were waiting.
That's all I asked, Joe. Thank you. Now, ordinarily, when a doctor examines a patient and performs an ophthalmoscope examination, that's something you put in the records.
Yeah, it's in the record.
But did you write in your reports here that Dr. Epen had examined the child?
That Dr. Epen had examined the child?
Yes.
Oh
That
boy.
would routinely be a part of the record. I would consider that to be optional.
So the answer is you didn't.
It's not in the record, no.
They let the kid's father examine him?
Now, would you agree? Withdraw just 1 second.
That seems strange. Paper shuffling, paper shuffling.
Ladies and gentlemen, we'll take a 5-minute in-court break.
5-minute break. Okay. Does this do the skip ahead seconds? No, it does not.
You may be seated. Court is in session.
Oh, they skip right over the breaks. That's great. So they edited it.
All right, I'll remind you that you're still under oath. You may conclude crossings.
Yes, thank you, Your Honor. Dr. Mann, would you agree?
It's not looking good, guys. It's looking like we're going to have to turn commercials on. We've only got 2 out of 10. Photo Lady 12, thanks for the 2. Please, no commercials. Stringer Bell, thanks for the 5. No commercials. Did you see the pics update of the potato pig dogs? I did, and they're so great, and I will show them to you too. But we got to hit the goal first. I will hold Jeff's dogs hostage. I will do it because that's what Jeff would do. No potato pig dog updates for you till we hit the super chat goal. We need 8 more, and I turn on commercials. That's how it's gonna work. Then after that, you'll get another chance to send 10 more to turn them off. That's my new grift.
It is extremely important when a child presents an emergency the way that Matthew did.
That away, Jim. Fine. Have my new puppy's kibble money. She can eat grass today. Jill, no fair. You pay premium? Not fair. Doesn't affect you.
Here's spearheaded to get a very good history.
God, Barry, can you speak into the microphone, please? I don't know why my audio boost isn't working.
That's true.
And by history, we mean the
go to the
status
microphone.
and condition of the child in the hours.
He keeps walking to the microphone and then walking away. This is very frustrating, Barry.
Days, even weeks prior to admission to the hospital.
Yes.
And as far as you knew, the reports you got is that he was in, I think the phrase is, normal good health that morning.
He walks to his notes, checks his notes, speaks into the microphone for a second, and then walks away. Barry, you do know you're on TV, right? Do you know you're on TV? You need to speak into the camera. This is becoming like the scene in Singing in the Rain, where he's like, speak into the bush. The microphone is in the bush. And she's all, I can't make love to a bush. You know? And every time she's like, oh, Pierre, you shouldn't have come. That's exactly what's happening here. And they keep sewing the microphone in different places. Like, okay, well, we'll put it in her dress then. And then you can hear the ba-bum, ba-bum, ba-bum. What is that, her heartbeat? God, I love that movie. Oh, Pierre, you shouldn't have. All right, we're at 6 out of 10, folks. 6 out of 10. We're getting there. We're getting there. Super stickers don't count, by the way. I don't know I'll count them, but YouTube doesn't. So if you do send those, I'll have to just make sure you tell me, because YouTube doesn't count them. I don't know why. I think that's a stupid choice.
That was my understanding.
Jim says this is the 90s. We didn't understand microphones and cameras and other voodoo witchcraft back then. That Joro, that's not true. I had premium and I got rid of it. I did. So she says, once you go premium, you can't go back. Oh, yes, I can. They used to charge $15 for it. Now it's like $25 a month. I ain't doing that. Sorry. Aspen Fallen, thanks for the 5. Been missing Jeff's live streams a lot lately. Thanks for doing these, Megan. P.S. I can't stop yelling. I have anxiety over the roof every day now.
I have anxiety over the roof.
You can thank Brad for the stream deck being downstairs in the dining room, because I wasn't going to bring it down. I was like, nah, I don't need that. He's like, yes, you do. It's your thing. You need your buttons. Now bring it downstairs. God bless Brad, you know? Photo Lady 12, thanks for the $2 super sticker. Appreciate that. Stringer Bell, thanks for the 2. Release the hounds. Miss you, Jeff. Debbie Ritt, thanks for the 2. Release the hounds. Frenchie's mom, GB, thanks for the $1. Appreciate you. Jill M's, thanks for being a member for 4 months so you can release the hounds. Been missing Jeff's live streams. Oh, we just read that one. Yeah, me too. Me too, guys. Me too. Let's see, where are we at now? Did we do it? Well, we're at 8 out of 10, including that super sticker that YouTube doesn't count. I don't know why YouTube does that. All right, Barry, speak into the microphone. It's right there.
Now, at any time during the course of the evening, did you request or suggest to Dr. Deborah Epen that she speak to Ms. Woodward and attempt to take as much as possible history of Matthew's status and condition in the hours before admission?
I didn't do that during the hour we had Matthew, no.
And are you aware of whether or not Dr. Deborah Epen did just that and made some notes? Did you ever see any notes that she made reflecting conversations that are history of Matthew's condition in the hours prior to his admission?
No, one of my responsibilities were
The question is, did you see those?
no.
And to the best of your knowledge, nobody told you about the content of any such conversation with respect to a history being taken by Dr. Deborah Eben?
If history items were relayed to me,
No, just did that or didn't.
I may have gotten the information, but not told to me that it was through this kind of transfer of information.
But as far as you knew, the only information that you got and that you were operating on, the assumption you were operating on, it appears throughout the medical records, is reportedly Matthew Epen was in normal, good health this morning.
Yes,
That was your operating assumption.
that's what we had to go on.
Thank you very much, Doctor. All right, you redirect.
There's something about this guy that his lack of confidence is off-putting. Oh, you did it, guys. You did it. We reached the goal. His lack of confidence is very, he seems very unsure and nervous or something. And maybe that's just because he's testifying in court and it's nerve-wracking or whatever. Mary Resnick, thanks for the 2 Singing in the Rain reference. And C, thanks for the 5. Okay, I have premium, but want to see the Hounds. Missing Jeff 2, first ever super chat. Aw, thank you. I appreciate that. Photo Lady 12, thanks for the 2. Okay. Here's part of my allowance. All right, let's go see the Hounds, actually. All right, as you can see here, Vice Baby has put an update on Twitter. It says a little update of the emotional support potato pig dogs. They are doing well and just got some pro-heart vaccination and checked for heartworm. No heartworms found. So here's Yoda looking very grumpy as usual. Look at his face. Wait, let me go where we can zoom in. Look at Yoda. He's looking very grumpy. Look at how cute he is, though. And then we have this adorable picture of Straubs, and she is wait. Strawberry's the brown one. Sorry, that was Strawberry. Isn't right? Yoda's more white. I always get them mixed up. Sorry, that was Strawberry. Then we have Yoda, who, this is funny. Look at this picture. This is so cute. Look at, aw, so happy. So happy. Yeah, Strawberry's more brown. Yoda's the white one. Look how cute. Look at him. He looks very happy, which is unusual for Yoda. He usually looks very grumpy. He does. He looks really good. I knew that was Strawberry. It's just that I get them confused. Especially because Strawberry looks so grumpy. I thought it was Yoda, because Yoda always looks grumpier to me. Isn't that funny? It's a cute picture, though. It's super cute. Connor, thanks for putting that up. It's always it's great for us to see updates on them and see pictures of them, because we miss them. They really need their own Instagram. Really, they do. They look really good. Their skin looks really good too. Did you notice? Did you notice that their skin looks really good? I mean, Straubs has here. Let's see. Let's go back to Straubs. So they have that eczema, and Jeff's always putting stuff on them, and but their skin is looking good. They look good. Aw. They look like they're getting lots of attention. So we're happy about that. All right, here we go.
Dr. Mandel, when Matthew Epen presented at the emergency room on February 4th, you did have some factual basis or history to base your subsequent actions on.
You know what I love about this prosecutor? He screams all the time. So even if he walks away from the microphone, we will be able to hear him clearly. Studio Vlog Channel wants to know, when is the next Hales Live? It's 1 a.m. here in Australia. The next one would be tonight at 8 p.m. on Tug's channel. I don't know if I'll be there or not, but I know he's going to be streaming, and he's got some really unbelievable stuff to go over tonight. So that would be tonight, 8 p.m.
Right.
Yes.
And do you recall what that history was that you received through the EMTs?
Yeah, the paramedics notified us by radio, and then in person upon arrival gave a report. And the specific report was that he had been put after.
Oh, objection sustained. The judge is all, wait.
Whether or not were you provided with the condition of Matthew Eapen as a history prior to his coming to the ER?
Yes.
Did that help you in your treatment and diagnosis of Matthew?
It helped us to prepare the room. Do you mean the radio call?
However you received that information.
We received the information by radio, by our medical control radio, as is routine for paramedics to notify us when they're about 10 minutes away. I think we got the notification when they were less than 10 minutes away, but it gave us the time to set up the room to perform the proper procedures.
And was that information used in furtherance of your treatment and diagnosis of Matthew?
The information that there was an unresponsive infant was certainly helpful to prepare for the treatment.
So that was the information you had?
As I recall, that was the gist of it, yeah.
Now, you've indicated you made no external findings during your emergency room primary and secondary survey of Matthew Eapen. Did you make physical findings consistent with violent shaking?
Yes. The whole clinical picture would be completely consistent with shaking.
And what is that whole clinical picture?
An unresponsive infant in deep coma with the posturing, the fixed and dilated pupils, and the retinal hemorrhages, and full respiratory arrest.
Very scary. What they knew to be true back then turns out to not be true at all. And people went to jail for it. Shaken baby syndrome, just like SIDS. You know how SIDS became like parents were going to jail for that too, and now that's like not a thing that anyone diagnoses anymore. Like there's always, and that never made sense to me either. Sudden infant death syndrome. It's like, no, clearly something happened. It wasn't just some sudden death. Like dig deeper, look harder. There's something else. Something causes death. It's not nothing. And it's same with the shaking thing. It's like, no, there can be multiple underlying causes that would cause the hemorrhages in the eyes, the pressure on the brain, all kinds of different things. And it's just really sad that so many people have been charged with these because of these medical doctors that just don't really know what's wrong. And so they're like, well, child abuse.
And did you make physical findings consistent with a head fracture?
We were not able to confirm any physical findings of a head fracture. That
Interesting.
diagnosis was made radiographically.
Interesting. No evidence of a head fracture. Okay. That's why they're saying, because there was no bruising, no nothing. That's why they're saying it had to be shaking and the bruising was internal, right? Instead of external, something like that. Yeah, I don't buy it either, Flux. Flux sighting.
And at some point, did you later learn the results of that radiographic testing?
I did.
And at some point, did you learn the results of the
PG Peach's sudden adult death became a thing during COVID. That's true. Don't demonetize me, YouTube. That was just a joke. That was a joke. That was just a joke.
Scans that were taken of Matthew Eapen's head and brain?
I did.
Now, based on those results and based on the way that Matthew appeared to you in the ER on February 4th, you have a diagnostic opinion with regard to what caused Matthew Eapen's condition on February 4th.
What? Beyond the scope and on that ground.
Would you like me to repeat the question?
One more time, yeah.
Based on the findings that you made in the ER and based on subsequent knowledge that you had.
The dog is
results of
having
the
a heart
CAT scan and the x-rays of Matthew.
Hold on. I can't hear a damn thing when he's doing this. Archie Ruckus, come here. Come here. I need to get the treats. Clearly, I need to get the treats. Oh my God, shut up. It's the 5-minute freak out. We're gonna have a 5-minute Archie Ruckus freak out, obviously. Oh God, hold on. Archie Ruckus. Hey. You want treats? You want treats? Come on. No, oh, not even the treats. The treats isn't even getting him away from the window. Come on. Treats. Get down. What are you doing? All right, there is someone here. He wasn't just barking at nothing. It looks like there's somebody here to read a meter or something. Come here. Come here. Do you want treatses? Do you want treatses? Here, come up here in the camera so they can see you. Come on, over here. Over. Can you get it? Wait. You're like trying to take it out of my hand. I'm trying to get him to come up here so you can see him. Come on. Jump up. Jump up. Come on, you can do it. Come on. Come on. Oh, that's a good boy. He did it. He did it. All right. Good boy. Good boy. I can't move the camera easily, and I can't set up another one for some reason. Well, I guess I could. All right, I'll tell you what. I'll set another super chat goal. We'll do 10 more, and I'll set up an Archie cam. Let's see. How do I do it? Oh, there. Start another one. Archie cam. I just have to go get the other camera. Start goal. Oh, hush. All right. Let's push play. This guy's facial expression is always the same.
Matthew's head. Do you have a diagnostic opinion as it relates to shaking and trauma with regard to Matthew Eapen as he presented to you that day?
On that ground, the objection's overruled.
Objection and grounds.
Please give me all the objections at once, Mr. Shea. Peel the onion at one point.
Relevance, materiality.
My opinion is that the physical examination findings and combined with the radiographic findings are a diagnostic with a high level of certainty of a severe head trauma.
Aussie.
And that
Aussie, you have an invitation if you want to drop in. It's in your Twitter DMs. I sent you an invitation this morning. He says he's a discount version of the bad guy from Titanic. We think he looks like a young Dr. Spiegel from the Depp trial. Like, this is what Spiegel would look like when he was young.
the retinal hemorrhages are extremely suggestive in virtually every case that they occur of inflicted injury, a shaken baby syndrome.
And inflicted in what manner?
Inflicted by through shaking and impact.
Thank you, Dr. Mandel. I have no further questions.
Oh, are you all right?
See if we can break it down.
Smacked his head on the table.
You're saying, doctor, that
Okay.
just retinal hemorrhages were observed. Therefore, you conclude there must have been severe shaking.
In medicine, we rank our diagnoses. That became.
Is that what you're telling us?
Conclude is maybe too strong a word.
All right. Well, the answers you just gave to Mr. Leone's questions, right? Based on your finding of retinal hemorrhages, or a finding of retinal hemorrhages.
Well,
That's where that is what you think is, would the term suggestive be a more accurate way of characterizing the testimony?
So I just want to be sure I understand the question.
Are you saying that the existence of the retinal hemorrhages is what is quote unquote suggestive of shaking? Is that what you're trying to tell us?
I would agree with that.
All right. And the term suggestive is the term that appears in the literature, suggestive. True enough?
Yes.
But you're not changing your answers with respect to your examination of Matthew Eaton's body, correct?
Changing my answers?
Yeah.
I understand.
Remember the questions
worries,
I asked
Nady.
you at the very beginning of the cross-examination about any marks or bruises observed on the body?
That what I said before is accurate.
And the retinal hemorrhaging, your logic is the retinal hemorrhaging, if I understand you correctly, is suggestive of violent shaking. That's the reason.
Yes.
That's what you've been trained to believe.
That's my training.
And part of that training is based on understandings of the article by Dr. Thibault and others.
Yes.
Now, I think that's it.
Thank you.
Your Honor, very briefly concerning that scope.
Thank you. You may stand down now. You know the rules.
Careful stepping down. Take the microphone out.
The heck? Who's this guy? Why did the screen get small? What happened? Hold on, I was getting the other camera. Why did the screen get small? Oh, and it's muted. How did that even happen? I walk away, it gets muted.
If I may have Dr. Madison's resume marked as an
Oh, the next video. Okay. Gotcha. Let me make sure it's turned all the way up. All right, who is this guy? Here, if I unembiggen, it'll tell us who it is. This is Dr.
Madsen, how long have you
Joseph
been a neurosurgeon?
Madsen, neurosurgeon.
I finished my training in 1989.
How many incidents of brain surgery have you performed?
I do about 200 to 220 operations a year over that period, so it must be over 1,000, I would imagine, a few thousand.
People's molars.
Yes. Is that better?
Archie's looking at the new camera. He's looking right at it. He's like, what the hell is that? And why is it pointed at me?
And of those brain surgeries that you've performed, doctor, how many of them were performed on small children?
My practice is about 80% pediatric, 80 to 90% pediatric currently.
Doctor, what is neurosurgery?
Neurosurgery is the area of medicine which involves the surgical treatment of any disease of the brain or spinal cord or peripheral nerves.
Now, with regard to the human brain, did you bring anything with you today which would help you assist the jury in your explanation to the jury of the workings and inner workings of the human brain?
Yes, I did, sir. There's a three-dimensional model, I think, that might be back on your table there.
All right, good news. The doggo cam is set up and working. but we only have 2 super chats, so we're not there. But it's set up and working, and he's sitting right in front of it waiting for his treats. This is so terrible. Maybe I should keep my office down here so that I can use the dog. Sit. He really wants his treats. Let's see, where are we at? We have 3 out of 10. Let's see, let's read them. Where was I? Photo Lady 12, here, thanks to the 5. Here, might as well take the rest of my allowance. Boy, your allowance is not very much. Flux, thanks for that. Not that I don't appreciate it. I do. I was just thinking, for an allowance, that's not much, ma'am. What are you buying with that? Flux, thanks for the 5. Are you barking at me? You muffing? Are you muffing for your treat? Don't be rude. He's like, Flux, thanks for the 5. Mocha Dick Poon, XOXO, fully adjustable blow for freedom. What does she mean? Yum, crock pot box. And always, as always, pants are prison. Kimmy, thanks to the 2 for the doggo cam. And Aussie Overlord, Law News and Laughter, thanks to the 5. Unleash the Archie. Lynn, thanks for the super sticker. Oh, we'll include that. So now we're at 7 out of 10. I don't know why YouTube doesn't include the stickers. Drives me crazy. I am my favorites. Thanks for the 2. I can hear he is ready and waiting. He is. He's sitting right there. He's being such a good boy. Such a good boy. Yeah. Yvonne Chavez, member for 4 months. Release the hound. Rare in history, thanks to the 5. Doggo. And Adair, thanks to the 5. Treats for doggy. And Hey Joe just popped up with the 5. I am a sucker for doggo cam. Well, guess what? We're only 1 away. Just 1 more. I mean, YouTube says we're 2 away, but I'm counting the super stickers. So yeah, 1 more. 1 more, and the dog gets to be on camera. I should probably turn the light on, though. It's a little dark in here. Let me turn the light on so you can see him better. Okay. That should be better. Ah, you're trying to steal your treat. No. Sit down. Sit. All right. We're still 1 away. We're 1 away. So I guess we'll go back to the trial. We'll just go back to the trial. Oh, Vice, baby. There he is. There it is. All right, here we go. Present extra camera. Oh, get your nose out of the bag. Okay, wait. Lay down. Lay down. There it is. All right, here you go. There, see? Archie cam. You can see my messy kitchen where the children throw all of their shoes and bags. I can't get them to stop doing it. Drives me nuts. Like I'm only going to be able to keep him here if I can give him treats every 2 seconds. He said, he's so cute. He said, "Come on, Mom, I want my treats." I know, but he gets bullyish about it. He'll bully me. You bully me. He's like, "Don't pet me. I don't want pets. I want treats. No, sit, stay. If you want treats, you have to." He's pushing the camera now. Don't push the camera. That's not how we do things here. You're a good boy. Good boy.
This is a model, ladies and gentlemen, I believe made of plastic.
Your Honor, may I approach Dr. Madsen with the model? Thank you.
Position yourself.
Stationary. I'm wondering, Mr. Leone, if the tank we put on for the
What else we
Oh, I see what you're gonna do, yes, that's fine.
Oh boy, we get a demonstrative aid. Look at this. It's a cranium with a. This is fantastic. We get a demonstrative, folks. Look at that. Oh, he has slobbered my hand something fierce. Ew. Ew, ew, ew. Demonstratives. You know, Jeff always loved demonstratives. No charts this time. No charts, but an open brain, an open skull.
Dr. Madsen, I'm going to show you 2 diagrams and ask you if these would also be helpful to you in explaining your testimony to the ladies and gentlemen.
Yes, these would be useful.
You want to maybe these 2 diagrams be marked as exhibits 2.
Yes, I think we'll mark them exhibit C and F for identification. Thank you. Thank you.
Now, doctor, that which is on the monitors, could you just generally describe what that is?
This is a partially cutaway view of an infant's brain, so that you can see the lobes of the right hemisphere in this case, and they've superimposed the face and cross-section of some of the skull.
Now, in reference to what is seen on the monitors, could you explain what is seen on the monitor and utilize the model to your right at the same time, knowing that we have a cut of the interior of the model, which we can expose at that time?
Yes. What would you'd like me just to proceed with some points about the model, or?
If you would, to the ladies and gentlemen of the jury.
I thought that it would actually save time if we went over some points in the three-dimensional anatomy of the brain, so that as we talked about where things were, we'd see them. This model shows the skull, part of the skull here. There are several bones of the skull which are separated by lines that are called sutures. They all have different names. This particular bone back here is called the occipital bone. That will come up later. That would be, in this picture we have the cross section of the skull, and the occipital area is in the back here. If I remove the brain and the top part of the skull from here, you'll see the immediate lining or the lining of the skull, which becomes usually a relatively tough outer covering of the brain, and that's called the dura. And it covers the entire surface of the brain on the inside, where you're looking at it on the bottom.
Doctor, if I could stop you there, would using Exhibit F for identification be helpful in explaining the area of the brain that you are now explaining?
I think I would hold off for a few moments.
Thank you.
To show the overall three-dimensional view.
Thank you.
I'm going to get him some carrots. He loves carrots. And then I won't be using the expensive treats.
The brain in a particular three-dimensional configuration. If I take the brain structures out, you can see that it folds around the inside of the brain and actually goes down in the middle of the brain and has wings which separate this upper part of the brain from a lower part of the brain that I have not taken out here, which is called the cerebellum, which won't come into play very much as we discuss things. The point I would make about the brain, which will be important to understanding some of the later events, is that all of the information from the upper part of the brain comes down to the spinal cord through a narrow, thin part of the brain called the brain stem, which you can see here. It fits into an area in the skull base like a hand in a glove, and you can also see here that it has numerous nerves coming off it. Those are called cranial nerves, and they have different functions, which we'll probably end up talking about in relation to this patient. The one other point that I would make about the hemisphere here is if I open it up and do what would be a cross-section in the hemisphere, it gives us a picture of what a CAT scan might look like or might show for one particular area of the brain. And we'll end up discussing at various points the distinction between the gray matter and the white matter. The gray matter, which is really pink in life, is here shown on the outside. And this is a fairly reasonable color representation of what they look like. The white matter is deep inside, and the distinction between the gray matter and the white matter is something that you can often see on CAT scans. I think that's we might look at that transparency that you prepared, Mr. Leon.
If I may, Your Honor.
This is an artist's representation of the skull. I'm sorry, of the skull here, the scalp over the top, which is composed of skin and some other connective tissues, and shows how the brain fits in beneath a particular tough layer called the dura. This diagram is actually somewhat confusing and inaccurate in that it shows what seems to be the dura as these two layers and something called the epidural space, which seems to be in the middle of that. And actually, the epidural space should be on the outside of the dura, and the space right below the dura is correctly marked here as the
More
subdural
zombie
space.
sounds.
But those are all important areas for the neurosurgeon because, among other reasons, blood can accumulate in those, as can tumors and other things. And that tells us where we have to go to get to them. This diagram also makes the point that there are veins in the dura, and there can be vessels which communicate from the surface of the brain going up into these structures in the dura. Those happen to be predominantly going to a large vein in the center here called the superior sagittal sinus, but you can see how there would be veins which might bridge from the surface of the brain here going up into the structures of the dura at the top. And that's what that diagram is meant to represent.
Now, is there anything further with regard to the 3D model which would help you and assist in your presentation to the jury with regard to the findings of Matthew Eapen's treatment and diagnosis while at Children's Hospital?
Well, I think if I had it here, I may be able to refer to it during the discussion of the CAT scans and other things, if that would
That's agreeable, Your Honor.
be okay.
Thank you. Dr. Madsen, could you describe for the ladies and gentlemen of the jury what a CAT scan is?
A CAT scan stands for computerized axial tomography, and it's a special type of X-ray that is taken by passing X-ray beams from a circle through the brain and then recording them on the other side, and it allows a reconstruction of layer by layer of the structure of the brain or of any other part of the body.
And what significance do CAT scans play in the area field of neurosurgery?
CAT scans are one of the, and now with MRI scans, are ways that we have of seeing inside the body without having to actually open it.
And on February 4th of 1997, at approximately 5:20 p.m., did you have occasion to be in the CAT scan room adjacent to the emergency room in Children's Hospital?
Yes, I did. The CAT scan room is in the same building, but not adjacent to the emergency room. But I happened to be there, yes.
Did you have occasion at that time to view a CAT scan of one Matthew Eapen?
Yes, I did.
John, may I close the witness? Madison, I'm showing you 3 CAT scans in chronological succession, and ask you if you could just briefly take a look at each, again in chronological succession, and ask you if you recognize those CAT scans.
Whoops. Muted boomer. Well, you can't have the show, remembering Jeff without muted boomer. I have my favorites. Thanks for the 2. My cat says he wants to see the dog. Elisha Towsley, member for a month. He's so cute. He said, come on, Mom, I want my treats. And from now on, any super chats that come in, $2 will get him, if it's a $2 super chat, it will get him a carrot treat. If it is higher than, oh, he just looked up. Did you see him? And if it's higher than $2, I will give him a meat treat. So it's up to you which treat you want to give him, So $2 carrot, $2 or less carrot treat. More than $2 meat treat. And he likes the meat treats a lot. Let's see, how many do we have left? We don't have that many left. We're going to have to, it's important to send the supers for that because I got to buy him a new bag of these. Do you know how expensive these things are? They're insane. Chicken jerky. It's really good though. And he loves them so much. Look, as soon as I touch the bag, he's like, give me those. Nope, down, stay down. Good boy. Good boy. Stay down. Stop saying treats. My dogs heard that. Well, why aren't you giving them treats? Every time I say it, he does the same thing.
So these were all February 4, 1997.
Ooh, and I'll tell you what.
Scans.
If we get, and here's what I'll do. I'll actually start I'll start a goal, because if we hit the next goal, I will get him a peanut butter treat. And that's really fun to watch him. That's really fun to watch him do. The peanut butter tire. It's so funny. And that lasts a while. So if we we'll do all the colors and we'll do 30 minutes. We'll do 10 more. Oh, it's not going to let me. Oh, yes, it will. Wait, let's see. Peanut butter tire treat. There we go. There we go. Oh, look at him. He's getting ready for it. He's getting ready for it. He wants it. Jill M sent $2. Carrot treat. There you go. See, that's how that works. He's going to get lots of treats today. I'm glad I didn't give him breakfast because he's going to be fat.
They are all, I believe, preoperative scans. So they were actually taken at the same sitting in the CAT scanner, and in fact represent different levels of cut and different ways that the computer on the CAT scanner reads the numerical information it has to make pictures.
Chat. We must keep super chatting for more treats. I mean, look at him. He deserves
If I
them.
were to exhibit these CAT scans on the view box to your right, would you be able to indicate, ladies and gentlemen of the jury, findings that you made specific to Matthew Eapen on February 4th, pre-operation?
Yes, I would.
Your Honor, if I may.
And yes, I did Boomer better with Tug last night. My God, Jill. I tried to leave the studio and I hit end stream instead. And he was talking to himself. He was in the studio reading super chats to himself. It was so awful. I had to go in there and be like, Tug, I'm so sorry. I killed your stream. The stream fell down. was so bad. I know the picture of Elon with the chainsaw is hilarious.
Now, starting with the CAT scan on the left, and reviewing the CAT scans as they run left to right, could you indicate what observations and findings you made that was significant
Should we make Archie Ruckus Cam
to
bigger?
Matthew's condition and significant to your eventual treatment of Matthew later that evening?
Yes, if I may point out, I'm pretty sure these are reprintings of the same CAT scan data. In other words, this is I don't believe it's 3 sequential CAT scans.
Rosalind
One
sent
CAT
money
scan
for a meat treat.
And reprinted to show different points of information.
Could you just in general, Doctor, describe to the ladies and gentlemen of the jury what they're actually seeing on each of those imaging studies?
Yes, I can. If you look at one of these pictures, there's a little brighter version here. This looks like it is a sideways picture of a skull. It looks like what you might see with a conventional
Rare in
skull
history,
X-ray.
Archie
If I
Ruckus,
refer
thank you
back to
for the
model,
meat
it would
treat.
be an X-ray taken from one side to the other. Actually, these are not X-rays that were taken with an X-ray beam going from one side to the other. They're called scalp films. They were actually made by this process that I mentioned of it's like a ring of X-ray tubes aiming at the head or whatever that are getting information from all different directions, and then mathematically computing what the 3-dimensional structure inside must be. So basically,
Oh shit! He's decided he doesn't want carrots. Oh no, he decided he's gonna eat it. Okay. I can't pay attention to the trial anymore. Just watching the dog eat treats. That was a close one, photo lady. He almost decided he didn't want that carrot. I had a few bucks left for carrots. Nice. Nice. What are you doing? You're getting off the you need to learn how to stay on the camera. You need to be, you have to get better at this camera thing. Rare in history, thanks to the $4 super sticker. He got his meat treat for that. And Rosalind says, to stop making my dogs look at me. I can't help it. I have to say the words. Carrot stick money.
On exhibit 16 to the second image.
I hope it's exhibit 17.
I'm sorry, exhibit 17, the second image to the right of the one.
No, he's too anxious. He's too anxious and high energy to be a potato.
Yes, the middle of the 3 images.
Right, so at the bottom row, there's 3 images and it's the middle one.
Yes, that would be correct.
Doctor, if you could, where exhibits run 17, 18, 19, if you could, when you're referring to each, refer to the exhibit number and row.
Oh, very well. Yes,
Thank you.
I will try to do that. Yes.
Thank
Let me. I think I'll speak mostly about exhibit 18 then, because I think it's clear, showing essentially the same information. What we saw as the images came up
Thank you,
on
Brenda.
the viewer, and I was actually looking at this in real time as they were coming off of the screen before these images were actually even printed, because I happened to be standing there at the time, is that there is a cross-section to the brain, which we were beginning to explain, that these would be cross-sections. Each one of these various images, I'm showing now the top 4 rows on the.
What are we learning from these brain scans? I feel like we haven't learned anything. What are we learning from these?
Represent cross-sections taken through the skull and brain in cuts like this, one here, one here, one here, one here, and so on.
Doctor, if I could just move that so that all the jurors can see that.
This is not the first time I've done the Archie Ruckus cam. I've done it before.
This model and actually cut it through.
So this is funny, actually. All right, so this is funny, actually. So I did the Archie Ruckus camera once before, where I set my laptop up downstairs by where he used to have his little bed. We had to get rid of it because it just stinks and I can't clean it. It's just crazy. Dog beds are terrible like that. So Anyway, I would set my laptop up downstairs and have that running. And then I'd be upstairs running the camera, but I would leave the sound on the laptop so he could hear me. And then I would call him to come to, and he would come right up to the camera and be like, where is she? She's not in there. She's, but it's not as easy to make him stay when I'm not in the room. And so he would, wander off, and then I couldn't get him to come back. And then I'd have to run up and down the stairs to like give him a treat to make him stay there. So it's a little easier to have him right here by me. When I do my stream in from the basement, I'll be able to, when my office gets moved down there, I'll be able to take him down there. He can't do the stairs though. He hates stairs. Well, it's weird. He doesn't do stairs inside the house, but I can take him outside, walk him down those stairs, and bring him through the door into the basement. And so he can hang out with me in my new studio. So then I'll be able to have a dedicated Archie cam. It'll be fun. I'll make a little spot down there for him, but he can't do stairs. And it's amazing because, German Shepherds are so, what's the word? Agile, right? I mean, they can climb walls and, they can do anything. So he can absolutely do stairs, but both German Shepherds I've had are terrified of stairs. And I've had to, and we have all wood, so it's very slippery. And I think that's one of the reasons why he's scared about stairs. So I think if I ever take him, so I can walk with him up or downstairs and he will come with me, but he really hates it. Like he hates going down particularly. Going up is not so bad, but going down, he's very scared of stairs. But it's weird because he's not scared of the outdoor stairs. So Bronco says, are we not doing LO Jingy stuff anymore? Well, there's just nothing to report right now. The appeal is, we're waiting for the ruling from the appellate court. And when they rule, certainly I will go over that. But there's really nothing to report right now. So, all right. I'm still trying to figure out what we are supposed to be learning from these brain scans.
Pictures that would look something like this. So what these images show is this gray substance, which represents the brain. The white circle around it is the skull, and the black dots that you see inside represent the ventricular system, which is something that I didn't show you in the model, but it's there, and it represents the fluid space that's inside the brain. These are all normal structures, and they're present in every brain. The abnormal finding here is that there is a crescent of white that is outside of the brain. That's one finding.
And what does that indicate?
That indicates blood, and that indicates blood that is on the outside of the brain in the space which we earlier named the subdural space. So it's the space below the dura, below this covering, and immediately outside of the brain.
You just indicate which ones you just indicated.
That would be the second row on Exhibit 18, Doctor?
It would be, yes, all of the ones on the second row of exhibit.
Thank you.
The finding, in addition to the to this white material, is outside of the white material there is a darker layer. It looks like, and I'm looking here at the sixth individual image, or the second image on the second row on Exhibit 18. So that there is a layering of some kind inside.
Who said that? Who said JD Buck just got back? Why are we looking at mugshots of Mexican wrestlers? Oh my God, that's what it looks like. The brain is so weird. Oh my God, it's so weird. It's true. It's really weird. Okay, I need a bathroom break, and I don't have a song or anything for that. So you know what? You're going to do squats while I take a quick bathroom break. Do your squats. I will be right back. You have 1 minute and 22 seconds to move around. If you can't do squats, just do a plank or something, or a wall sit, or some chair yoga. I don't know. Just do something. I'll be right back.
You impose fatness on you. You did it by going.
Wait a minute. Hold on. Can you hear that? Did anybody? It had no sound for me. That is so strange. When I started playing that, did you hear any sound? Anyone? You did. Okay, that's so weird. I didn't. That's the first time that's ever happened. Huh. Okay.
You impose fatness on you. You did it by going, oh, I want the butter on the popcorn. Oh, I want the butter on the ice cream. Oh, I want the butter on the sandwich. Oh, I want the butter on the salad. Stop eating butter. Can you just get up, walk 1 mile?
To squad!
Walk farther. And if you can't walk, crawl, roll, get dragged by a goddamn forklift. Whatever is wrong with you, just move. Ever. Get off the chair, get off the couch. No one is coming to service you while you sink into that furniture, while you become one with the pleather your poor ass got on that Walmart couch. Can you try not floating into sadness? Stop eating, stop drinking, start walking, start doing anything that you haven't been doing, you fat piece of shit.
All right, I'm still making coffee. Let's just let the brain scans play while I get my coffee.
Blood collection. And the other thing which we notice is that everything in the brain has been shifted from the right to the left somewhat. So all of these, for example, the 2 dots here which you see on the 7th and 8th images of Exhibit 18, should normally come to lie right in the very midline of the patient's brain.
Carrot stick money.
On this case, they have been shifted over something like 1 centimeter or 1.5 centimeters from the right side to the left.
Thank you, Pink Sparkle Racing.
The thickness of this blood clot is something like 1.5 centimeters thick, and so the implication of all of this is that in part the blood clot is pushing on the brain and pushing it over to the side. The other finding which was evident, which refers to the what I was mentioning before about the distinction between the gray matter and the white matter in a CAT scan, is that you can, if you
eat your carrots,
blur your eyes a bit, or perhaps before you're sitting, you can see that there is a little bit of a different texture, or a little bit lighter shade of gray out around the outermost edge, and a little bit darker shade of gray in this area. I'm indicating the sort of a butterfly shape within the substance of the
eat your carrots. You're left a mess. Clean that up. Clean it up.
Doctor, if I could just stop you there. The indications that you are making on the CAT scans now,
Meat treat.
you indicate there's certain significant boxes we can analyze and put in.
Thank you, Marilyn.
Okay.
Meat.
That was one over in the second row on Exhibit 18. Is the one we were pointing at.
Come on, get it.
But I think it is typical of all of
You can do it.
those images. And what we see on this image, which will be much more apparent on later images, is that the normal healthy distinction that we saw between the gray and white matter is...
He's being so gentle so he doesn't get my
And in
finger.
fact, that evidence which is evidence of swelling within the brain tissue, is already present in both the right and the left hemispheres at this time in the brain. So that's, I think those are the principal findings in the CAT scan. I might mention one other finding, which was a retrospective finding. Later on, when we
Wait.
knew about the,
Back up.
skull fracture, which knew
Let's
about
back up a
the,
little
later
bit.
on when
Look
we,
at that one. Wait, nope.
knew about the,
No, a little bit
later
further.
on when we knew
That thing
about
looks
the,
like a sad puppy.
skull fracture, which
This thing, look at, it looks like a sad dog, doesn't it? And my dog is going to be very sad if he doesn't get that peanut butter treat. You know, speaking of sad puppies, we've got a peanut butter treat goal out there. We're only at 5 of 10. And there's only 12 minutes left to get 5 more super chats so he can have a peanut butter treat. Look at how excited he is. Look how excited he is just to hear the word peanut butter. He's like, damn, I need a peanut butter treat. Or he's going to look like that brain scan. Not bad, right? The grift is getting better. Sad puppy hoodie. That should go on a hoodie. Oh, man. Yeah, Archie Ruckus. His full name is Archimedes. Archimedes Ruckus. Archimedes Ruckus Fox. And the children named him. His sire's name was Ruckus, so I gave him the middle name Ruckus. And that may have been a mistake. You know how they say don't name your kid or your dog something like Loki or something that means chaos? Yeah, giving him the name Ruckus was probably a mistake because he does cause a ruckus, man. It does fit him though. It fits him. It really does. When he was a puppy, he is so smart. Oh my God, he's so smart. He did this thing. We call it slip and slide. He makes a slip and slide out of his water. He takes, you know how German Shepherds, well, most dogs do this. When they drink, it pours out of their mouth afterwards. Well, he would take mouthfuls of water on purpose, turn around, run out of the room, throw it on the floor, go back, get more water, throw it on the floor, and then he would slide through it. One day, I'm upstairs and I hear, this is so funny. Here, let's make us bigger so you can see him while I tell this story. One day, I hear this big clatter from down, and I'm upstairs. I come running downstairs, and the dog had made a slip and slide with his shampoo. He found his shampoo in the bathroom. He grabbed it. It had a broken lid, so it was open. He squeezed it on the water that he had thrown around, and he slid through it. Bye, Connor. It was good to see you. He slid through it, and I remember, I'm like, what is that smell? It smells like tea tree oil. It smells good down here. Like he was cleaning the floor. He was using himself as a mop. He was cleaning the floor with his shampoo. It was the funniest thing. I couldn't even get mad at him. And he had slid into the fireplace thing. We had like those grates, and he had knocked it over. And that was because he was sliding around in the soap in the water. I mean, this dog is incredibly smart, but also really stupid at the same time because he does things like that. Like so smart though. Like he created his own slip and slide, his own slippery slip and slide with soap. I mean, and who could get mad? He was actually cleaning the floor. I mean, and he smelled good. So it was kind of a win-win. I just wiped him up with a towel and we moved on. He could be Knievel reincarnated. I mean, honestly, Connor, we need to play Red Dead soon. Flux, we need to set up a game soon. I guess I need to get back into trucking too. We should probably do that again. All right, here we go.
Only not on this scan, not apparent on this scan, but later when traditional skull X-rays were taken, it appeared that there was a skull fracture below in the occipital bone, this bone in the very back of the brain, which I indicated to you earlier. And it's possible that you can make that out as a thin line there on the CAT scan image, but it was certainly not something that I recognized in either the few minutes when we first seen this scan on February 4th.
Is that unusual for a
Thanks for the carrot treat, Adair.
On a CAT scan not to pick up a fracture such as that?
It's not at all. It's not at all unusual. In fact, CAT scan is not the best way to try to see skull fractures. It is a very excellent way to see all the structures we need to see about skull fractures in relation to brain injury, but we need to know for planning surgery.
And you're indicating what you previously called the writer's scout film, which is the second, the middle box in the bottom of Exhibit 18.
That's correct.
And could you indicate whether that skull fracture at the time that you were assessing Matthew's condition had any clinical significance to you at that time?
It did not have any significance in the sense of what our next move would have to be. In the strategic sense of the clinical system.
You want to move Exhibit 18 to the tell us where?
Yes.
Thank you, Doctor.
I feel like we never learned much during the prosecutor's questioning, and I learned more during cross. And I feel that way about all trials. I feel like I always learn more when defense crosses. I don't know why that is, maybe because I'm biased against the prosecutor, but I just always feel like the context is always missing until the cross happens, which I guess kind of makes sense because you have to challenge things in order for it to make sense, right? At some point, you have to ask questions.
Now, Doctor. Doctor, for the record, this is Exhibit 18. If we're moving left to right from top left-hand corner.
See you, Rogue. Thanks for all your help in the chat, by the way. Rogue Mama is a very good mod. Everybody give her a round of applause. She does a lot of work on this channel, and I appreciate her. And all of you who are the mods on this channel. I know you guys work hard. Oh,
Dr.
thanks for
Madsen,
the carrot treat.
This is focusing on box number 6. We go from top to bottom, left to right. And I'd ask if you would, could you indicate for the ladies and gentlemen of the jury, if you could look on your monitor, what we're seeing in this area here?
Yes, that is a subdural hematoma. That's that crescent outside between the brain and the skull, which I mentioned.
Oh God, look at this tiny TV.
Well, subdural hematoma is a blood collection that is subdural, means below the dura. The dura is the thick layer over the brain. So it is a blood collection below that layer and outside of the brain.
And there are the other findings that are significant in that block.
There is a
Oh, I forgot my coffee.
general. The other findings that are significant just in this particular image. There is the midline shift. This should be exactly in the middle of this brain. We estimated the shift to be about 1.5 centimeters, probably. And the general light and dark texture of the brain is abnormal here. It is darker than it should be, and the distinction between the gray matter and white matter is less distinct than it should be. I think those are the major findings.
Thank you, Doctor. If you could please retake your seat.
It did look like a fingerprint. You're right. There is nothing wrong with my feet, Slug. They're cozy in socks. Photo Lady 12, thanks for the 2. My husky will mug you for some peanut butter. I don't think he wants another
Doctor,
carrot.
based on your
I'll give him a meat
observations
treat.
of the midline shift, the subdural hematoma, the collection of blood, and the differential in the gray-white matter, did you at that time form a diagnosis and formulate the next line and step of treatment for Matthew Eapen?
Yes, also based on the on the patient's clinical situation, which perhaps the jury has already heard about, but the patient was in a very severely compromised neurological state. He was requiring ventilatory assistance and had bilaterally dilated pupils. So between that degree of a fairly desperate neurological situation and this finding of a mass in the brain that we thought we had a chance, that if he had any chance at all, would require very rapid action to remove that. My next move was to call the operating room and say we had an acute trauma and that we had to operate on this patient.
And did you do that?
Yes, we did.
On the way to the operating room, how was Matthew Aiken breathing?
He had been
2 minutes
intubated,
left,
I believe,
guys.
in the emergency room at Children's Hospital.
2 minutes. Look at that face. Look at this face. Doesn't that face deserve some peanut butter? I mean, really. Just the face. We only have 2 minutes and 15 seconds left. And what's the goal? Oh, we only need one more. One more super chat and he gets a peanut butter treat. You look at him. Look at him. He's like, me? What? Do you want peanut butter? Well, who doesn't? Who doesn't want peanut butter? Do you want a peanut butter treat? Just one more. That's all we need. Are we going to make it? If we only have a minute and 47 seconds. Come on, somebody wants to see him get peanut butter, right? Somebody? Anybody? Robert James for the win. Yes, you did it. All right, that means I have to go and make a peanut butter treat. Hold on. Hold, please. I'll just go get this stuff. I'll make it here in front of you, and it'll drive him crazy, too. He'll go crazy. Let's see. I hope I can find the tire. It should be in his toy tin. Hold on. He's like, what did I do to deserve all this great stuff today? Archie, come. Sit. 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 Good boy. All right. Let's see now. Oh, it's a brand new thing of peanut butter, too. Look at that. All right, so I have the rubber tire, and he's just smush it in there. Oh, he loves these. Now, sometimes they tell you to freeze them so they last longer. I've done that once or twice, and usually I mix it with pumpkin because it's just better for him, you know. Peanut butter can sometimes get too sticky, but he doesn't seem to mind. He is not picky when it comes to food. People are like, he's going to puke with all these treats. Like, no. This dog has a stomach made of steel. He can eat metal and be fine. He is having the best day. He's like, oh my God, I'm getting all this attention. Plus mommy is here. Normally when I'm upstairs, I'm not with him and he doesn't like that. So he likes to be right here next to me. So that's going to be really cool when I have my studio in the basement because he can come down with me and he'll like that. He's going to have to learn to use the stairs though, because I'm not always going to want to walk him around outside. And he should be able to use the stairs, but he's just a big baby. All right, are you ready for this? It's all done. Okay, come here. You want some? No, you don't want it? Yes, you do. He's going to run off with it, though. I'm going to have to make him sit down. Here, lay down. Lay down. No, you have to lay down first. Down. Down. Okay, now I got to get the camera. Here we go. All right, down. You stay. No, don't get up. Lay down. He's not going to let you see him. All right, there. Hopefully he won't pick it up and walk away. Traction tape on the stairs. We do have traction tape on the stairs. He doesn't, he just still hates it. All right, that's going to take him a while. So you guys get a reprieve from the super chats. I'll stop begging you for them. All right, let me see. Who did I miss? Make sure I got everybody. Lynn sent us 99-cent super sticker. Thank you so much. I have my favorite, sent a 2. I can hear he is ready and waiting. That's right, he was. Member for 4 months, release the hound. Let's see, where else? Where were we? Jill, did you? Oh, we already got these. Okay. Meat, says Marilyn. He got it. Pink Sparkle Racing sent 2 for the carrot stick. Carrot stick money. Lynn's, thanks for the $1. Adair K, thanks for the 2 for the peanut butter treat. I have my favorites, sent a 99-cent super sticker. Thank you. And I have my favorite, says, what's up, Ruckus? And Photo Lady 12, thanks for the 2. My husky will mug you for some peanut butter. Oh yeah, this dog will mug me for these meat treats. He loves the chicken jerky so much. Robert James, thanks for the 2. And Yvonne Chavez, peanut treat, mommy. I know, I'm so mean holding him hostage. No, but he's having a great time. This is fun for him.
And was receiving ventilatory support through the endotracheal tube.
Now, the area of the head and brain where you viewed the subdural hematoma, the blood clot, if you will, what area of the head did you observe that?
That was covering the right side, diffusely over the right side of the brain, and the thickness of the blood clot was probably thickest right above the ear on the right side, but it really covered the entire hemisphere.
And in preparation for the brain surgery, what did you do?
Do you mean once in the operating room, or?
Yes.
Well, I met briefly for the first time with the patient's parents, explained the situation, said that this looked like a large hematoma. They, as you know, the parents are physicians and understood that in the setting of acute brain injury and midline shift of the brain, the only possible hope was to try to get the blood clot out quickly, and hoped that the problem was all caused by just the mass of blood and not other effects of trauma. So we obtained consent. The one team was wheeling Matthew up to the operating room. I think I went by my office to get my operating loops, which are magnifying lenses we use to do this kind of surgery, and then went into the operating room.
And what was your primary concern going into the surgery on
Well, the primary concern was to try to relieve the distortion of the brain caused by the blood clot, and to try to let the pressure off of the brain. The principal thing that we were afraid would be dangerous to Matthew was a severe increase in the pressure of the brain, and if we could get the pressure off, that would be the best we could do.
Could you please, for the ladies and gentlemen of the jury, describe the surgery from the shaving of the head right through to your removal of the blood clot, and then your finishing of the surgery?
Yes. The Matthew was brought into the operating room.
He's enjoying this.
It did not take long to induce anesthesia because he already had the breathing tube in place. He was positioned, retrieve the model. He was positioned so that his right side was up and toward us. The right side of the scalp was very quickly shaved.
I'm sorry, Doctor, could you turn the model around so the jury can see?
Yes,
what
I
you're
can.
referencing? Thank you.
The top of the scalp on the right side was quickly shaved so that we could apply antibacterial
brain surgery
solutions
is scary.
to the skin very quickly. And then an incision was made in the scalp, which is a large curved incision shaped something like a question mark coming down in front of the ear this way. That kind of incision gives us access to most of the hemisphere of the brain to try to decrease the pressure. That cut goes all the way down to the bone. The flap of the scalp was then brought forward as one large piece so that we were looking directly at the bone. Then used a high-speed drill to make 3 holes in the brain in the bone. They're called burr holes, and this is the characteristic way that we would do all kinds of surgery where we need to get into the inside the skull. We have a drill that we can drill down through the bone and stop before making an opening in the dura. So we expose through those holes and then have a second saw that very quickly was able to connect those so we could remove a triangular piece of skull material and pass that off to a scrub nurse.
As you entered Matthew Eapen's skull, can you describe how the head responded to that entrance?
Well, at this point, before we had opened the dura, we could just see the dura. The dura was very tense. And we didn't waste any time in letting the blood out, which was the reason that we were there. With a scalpel, I made an incision in the dura, and with the first incision, the fluid that was inside the brain, which was bloody fluid, literally squirted out at us under high enough pressure that my assistant and I, who were standing a foot or so away, had this fluid spray at us onto our surgical gown.
Oh. Did that have any significance to you, doctor?
Well, it was a demonstration of what we had suspected and feared, that we were dealing with a case where there was very high pressure inside.
Okay, so this reminds me of a story that's kind of gross, but also infuriating. Mr. Fox had deviated septum surgery when we were first married. We were just married, and he couldn't breathe because the bone, probably from having a broken nose or whatever at some point, was blocking his airways. So they wanted to do the surgery. So he goes in for the surgery, and what they do after they break your nose and they realign it, and they throw he was a boxer. That's true. He boxed in Golden Gloves. So they pack this stuff like a packing all the way up, and it goes all the way. Like it's it's almost like when they do wisdom teeth and, they pack the hole. Same thing. They pack your nose with this gauze stuff. And he comes home from the hospital, and he is soaking they had like the pad under here, and that thing it's bleeding. It's bleeding a lot. And I kept changing that thing. You done? Did you finish it? Yeah? You good? Was that yummy? And it was bleeding so much that I called the doctor, and I'm like, I don't think this is right. And he was out of his mind and with a high fever. And I'm like, I think it's infected. I think something's wrong. And they said, well, take him back to the hospital. So I take him to the ER, and this doctor, and these are supposed to be medical professionals, right? He says he's going to take the packing out of the nose, and he uses these like tweezer things, and he starts to take it out. And it's long, like a trick, like a clown trick, like he's pulling and pulling and pulling and pulling, and it's coming out. And then as soon as he got it out, blood shot out of his nose and all over onto this doctor. And instead of being like a professional about it, like you think he doesn't feel bad enough, right? Mr. Fox felt bad enough, like having this, he's like sick with fever and everything else. And he's got this horrible infection that could be going to his brain. And the doctor jumps back and goes, and he's like, oh my God. I'm like, are you serious? What a bedside manner, you piece of crap. Like here, he's like dying. And you're mad that you got blood on you. You're wearing scrubs. That's what they're for. That happened to my grandma once too. Like she something like some bodily fluid, I don't know what, got over on a nurse's shoes, and the nurse just started freaking out. And it's like, you know what? That's not how you treat people in the medical industry. Like when you're in the medical industry, you deal with bodily fluids and stuff. Like that's your job. So you need to behave like it's no big deal and reassure your patient. Like, don't worry about it, Now, of course, in this case, their patient was unconscious, so it probably wouldn't have mattered what their reaction was. But I really can't stand it when medical professionals don't act professional and they act like like it's gross or something, this medical problem you're dealing with. That's not okay. I mean, it's not okay. It's just, that made me so angry. It made my husband angry too. I remember him just being, he was like, he could have died. It was so infected that it was going to his brain. And this guy had the nerve to be like, I just wanted to punch him. All right, he's had enough of us now. He's going away. If he comes back, I will put the cam back up. He's going to go take a nap, I bet. Oh, yeah, I was terrified. Celestial Force, we were both terrified. I thought he was dying.
Ladies and gentlemen,
Are we going to do cross now?
talk about the case.
Oh,
read
he's
about
back.
The case, or watch television about the case, or listen to the radio about the case. See you tomorrow, and we'll continue with the schedule that we have set today. That is coffee around 10:30, lunch approximately 12:30, and resume at 1:30. Thank you all for your promptness this morning. We'll see you tomorrow.
All right.
Would you leave with Mr. Marks your books with anything that you may have that may have been handed out to you today, please?
Look at him. He's so cute. All right, I guess we're moving on to another. He's going to take his little nap right here on camera. He's becoming a pro. All right, we've started a new.
Could you please do that at this time?
Okay. At the time we had concluded yesterday, yes, sir. The dura was open and the blood clot was starting to come out. The blood clot came out mostly under its own pressure. It was red blood and clear fluid squirting out first. As we opened the dura more widely, the remainder of the blood clot, which was jelly-like in consistency, protruded itself out through the opening in the dura. We continued to open the dura more widely and removed all of the clot that we could see, so that we were looking just at the surface of the brain. At that point, there was a period of few seconds probably, where things were relatively calm. Then some additional bleeding started. This time the bleeding was in the subarachnoid space rather than in the subdural space. Mr. Leone, if you'd like to put that one of those pictures that had the layers of the brain, I can just explain this point. The arachnoid is a layer which is a thin, transparent layer which is below the dura and closer to the brain. The blood that came out in the first instance, right out through the dura, was clearly in the subdural space. What we were seeing now was blood that was building up in the subarachnoid space.
I'll show you what appears to be a slide of the material you referenced yesterday. I'd ask you to take a look at that slide and ask you if that would be helpful in your discussion.
Yes, that's the slide I was referring to.
Yeah, Archie got the message. I wanted him in front of the weird black box. And he came back and decided to nap right on camera. What a pro. What a pro. He's such a pro.
Your Honor, I believe this would be marked as a chalk, but.
Not going to be introduced with it? Fine. Oh, let's just leave it as it.
Okay, fine.
These schematics. We just agreed not to send it where it wants.
Okay. Hold on one second, Doctor.
think it's.
I guess it really doesn't matter.
The orientation doesn't really matter because the point is, it's not that hard of a point to make. But there is a space here called the subdural space, which is between the dura here and the arachnoid here.
JDK Buck is memeing this doctor, this neurosurgeon. What is that? Is that the Great Oz? Is that what that is? Is that the great and powerful Oz? It's true. What? It's funny that the neurosurgeon does have this very giant forehead, giant head. It's funny. Oh my God, JDK Buck, this is so funny. This is the content I'm here for. This is why I'm doing this, because the chat always comes up with the greatest memes. He does. He looks like this is so funny. Oh, bask in it, folks. This is what we're here for. I can't believe I didn't notice what a dome this guy has. Of course he does. He's a neurosurgeon. The simulation does not disappoint.
Initially,
thank God I checked
all
Twitter.
of the blood that was removed was in this region. That was under high pressure. As the pressure came off, and after a very short pause, we started to see a lot of blood building up in the subarachnoid space. And I could tell that because this was not free blood coursing over the surface of the brain. It was bounded by this transparent or translucent membrane over the brain. Just as that happened, the brain itself started to swell up very dramatically. I think in the operative note I said it looked like it was a loaf of bread rising out of the skull, but it really was coming to the at least a couple of centimeters, an inch or more out of the margin of the skull, which had originally been cut to get the blood out. When this happens, it's very frightening, obviously, and one of the concerns is, will the sharp surface of the skull actually cut into the brain, because the brain is under such high pressure in that situation. The thing that I decided to do was to take the drill and enlarge the opening of the brain. So I ended up removing a larger area of bone that was basically all of the area of the bone that had been exposed on the surface of the skull. I could show that with the model, perhaps, just to outline how.
Let Ms. Leone ask the question.
I'm sorry.
I don't believe this model has been marked as an exhibit yet. May it have been marked?
Would you like to mark for identification?
No, it doesn't have to.
Ginger, don't puke. Just try to put on your medical cap
correct.
right now.
So the original opening had been a triangular area.
I find it interesting.
Here, basically, this was enlarged with the use of our drills to a space which encompassed much of these bones in the frontal part of the skull. I did not see any sign of a skull fracture at that time in removing that part of the bone.
Is it me, or does the head look like Buddha? That looks like the dreaming god. Why does that model look so satisfied and happy with his brain exposed? It's just funny. Although, what would you do? Put a grimace on the model? Like, it might be funnier.
Brain continued to herniate outward at me, and at this point, because of the blood underneath, it was the concern was, where is this additional bleeding coming from? I knew that it was not uncommon that that there can be vessels that are torn, which are simply not bleeding because they're under pressure, and when you let the pressure off, they then start to bleed. And basically. I made the decision to simply leave the skull out, leave the dura open. Those are both things that we would, in any normal craniotomy, we would carefully stitch the dura back closed, replace the bone, and then reclose the skin. In this case, I decided that the only way we were going to be able to get Matthew off the table would be to close the skin over what we had, leaving the brain herniated out the way it was, and proceeding directly to a CAT scan to try to see if there was any other underlying bleeding or a particular blood clot that would be worth going back in to take out, or was there bleeding on the other side, something like that. So that was the plan.
When you say it was the only way we're going to get Matthew off the table.
Well, I think the whole team looking at this spectacle.
Excuse me, I think what Mr. Young wishes you to do is to say in plain English what the youth
I'm sorry, that we were afraid that he might die on the table.
Thank you. Could you proceed?
We did go ahead and close the skin over the brain as it was coming out. One of the difficulties about this is that the brain was pushing out so far, even with the removal of the skull and with the dura being open, just trying to get stitches into the skin to pull the skin together. Whenever we would do this, the brain would be herniating out on both sides of the opening. It was a very unhappy sight.
So was a photograph taken of this process which would be helpful in your explanation to the jury of this stage of the surgery, doctor?
Four photographs were taken at this point. There was.
Oh, do we get to see them?
Yes, a photograph would help me.
May I approach the witness?
Does the jury get to see the photographs?
Doctor, I show you a photograph and I ask you if you recognize what's depicted in that photograph.
Yes, this is a photograph of this stage of the surgery that we're discussing on Matthew Eaton.
Kim Dodds wants me to know that at this point, Jeff would have Captain Star Trek Picard screaming, "There are 3 lights shining off the witness's head." Do I not know that? I don't think I know that button that he used. I still have to add Jeff to my buttons. I still need to get him screaming my name because he used to do that a lot. And I also want the fascinating story. Any chance you're nearing the end? And I haven't got them yet. What do you mean I'm not giving Archie Ruckus the stage he deserves? He's on stage. He's right there. Do you not see him? Look at how good he's being. He's being so pro, staying in the camera and everything. There are 4 lights. I must have missed the Picard screaming button. I don't know about that one. Somebody send it to me in my email.
John, may I have this marked as an exhibit?
Yes, that's exhibit 21.
And may I publish this photograph to the jury?
You see.
All right, there. His camera is now bigger. Are you happy? But that's going to be weird. You want Doggo Cam even bigger than that? It's going to end up covering. Here, maybe
No, I turn the slide that we've just utilized to mark as an exhibit.
All right, how about that? No, he's going to cut off people's heads. I can't make him any bigger. Have we given this model a name? We have not. Siddhartha, possibly? We need to give him a name. Brainiac.
Doctor, if you could further your explanation to the jury by utilizing what we see on the monitors, telling them what it is depicted in the photograph as it relates to your surgery.
Okay, I think the first thing to do is to explain what those grid lines are.
Bob Brankowski.
Yes.
There's some way of doing this a little more.
See, no, this is covering up Barry, or the prosecutor, I mean. I have to move him. I have to move the dog back. I'm sorry, he can't be that big.
All right. You know, if the lights in the courtroom were dim, it may,
Not sure.
Bobby Brain Model-esque.
That clock on the right-hand side of the
Neurotic Bob.
image, that's the label that marks it.
Right.
Brainy McBrainerson.
May I proceed, Your Honor? If you could now describe what we're seeing as it related to your surgery on Matthew Eapen on February 4th, Doctor.
Okay.
Doctor.
This is the right side of his head up.
I guess we don't get to see the
I
picture.
believe his face and all unshaved parts of the scalp are now under drapes, so that we can't see them. But what you're seeing in this part of the photograph,
I like
is,
Brainy McBrain
what
face.
has been
I think with Brainy
shaved
McBrain
and
face.
prepped and draped. The incision in the
Richard
scalp
Cranium is pretty
is
good,
shown
though.
here, and I believe it would be curving down in front of the ear here for the full length of the incision. And this is fairly late in the closure.
Oh, we get a shot of the press.
Someone happened to come back into the room.
Well, let's pause on this for a moment. Check out the fashions of the press from 1997. So these all look like reporters, don't they? Look at that old briefcase. It's like a suitcase, like a square one. Look at that. Look at that. This is a moment in time, folks. Look at what all the ladies are wearing menswear. That was a big deal in the 90s. You know what it was? You know why? And I was there. I can tell you why it was. And you're going to roll your eyes at this, but it's true. Sexual harassment was so bad in offices in the 90s that women started dressing like men. I did it myself because I felt so exposed. Like it was bad. Dudes would touch you. Like if you were wearing a skirt, like it had happened several times where some guy would run his finger up my leg. Like it was out of control. Sexual harassment in the workplace was out of control. And the EEOC did a good thing in the 90s when they cracked down on it because it was bad. And I'm telling you, that's why women were wearing menswear, because we got to the point where it was like, okay, you can't wear anything feminine to the office because you're a target immediately for these sales guys, these old school sales guys who would just be, you know, some of them were sweet. You know, there's a difference between a guy who calls you honey and sweetheart, who's being fatherly, and a guy who's chasing you around the desk. And I worked for a company that got sued in the largest sex harassment case in Illinois history. I was a witness in that case, and they lost big time. And the atmosphere there was so bad. Yes, it was like 9 to 5. Yes, yes. The atmosphere at this company was so bad that I stopped wearing. It was summertime and it was really hot in Chicago, and I had worn a sundress, like a long dress, but a dress nonetheless. And some guy literally ran his hand up my leg. That was the last time I wore a dress to that place. I wore pantsuits after that. You had to like put on chastity belts and stuff to stay away from, to send the I'm not available signal. It was nuts. It was nuts, but that's why they all look like this. That's why they all look manly. In fact, this one's being very brave over here. She's wearing a skirt. But yeah, it was a crazy time. It was a crazy time. It's still the same? No, I don't think so. I mean, it's been a while since I've been in corporate America, but my husband works in corporate America and it's not like that at all. They will fire your ass if you do something like that. Yeah, dudes were just really touchy in the 90s, like super gropey. It was weird. Oh, I know, Slug. It totally happened, though. Slug says, I get nervous even talking to women. I can't imagine groping them randomly. Oh, managers would come up behind me and start massaging my shoulders. I swear to God, that's the kind of stuff that happened in the 90s. It was brutal. It was weird.
With the camera at that time is why we happen to have these photographs of the end. And you can see some places where this skin looks like it is being stretched outward. It is fastened together with a few stitches coming across, and you can see that the part which is unsutured has brain tissue, which is actually coming out of the opening toward us at that time.
Oh, not only were there sex jokes, Diane, in the company that got sued, the one I worked in that I was a witness for the sex harassment, they had porn hanging on the walls. Literally in the bullpen where the guys were making sales calls, they had centerfolds hanging up in their cubicles and all over the walls, naked women. And there were women working in this office, and they didn't care. They were bribing the women in the office with money and stuff, and bribing them with drugs and stuff to get them to do favors. It was bad. It was real bad. The guy who owned the company was a close friend of Bill Clinton. Big surprise.
It shows some dark areas here which represent blood, which is in what I described as the subarachnoid space, the space underneath the membrane, and the pinkish tissue here would be brain tissue. And in order to actually close this, or to try to bring it back to closure without causing too much damage to the brain, just with our sutures, with our stitches, I believe I held a plastic-coated retractor in to try to hold the brain down a bit, while my assistant pulled the two parts of the skin together, and then we put stitches in together. But it was clearly under a significant amount of pressure, even though we had opened things up widely, taken out the clot, and left the bone out.
And whether or not the swelling, the herniation of the brain continued post-surgery.
It did continue post-surgery, and in fact, having done the decompression that we did allowed the midline of his brain to come back to where it belonged. In other words, it did let some pressure off of the brain, but for the remainder of his time, the brain tissue never went back into where it would have belonged in the normal shape of the skull.
Thank you, Dr. Manson. This time I'll return the exhibit.
Wow, you guys, this is the first time I went to check the
Doctor, could
lights.
you describe
And with 200 of you here, there are 207 likes. Fantastic job on the like button, you guys. Fantastic. Oh, you want me to check my email? Okay, doing it now.
latter part of the surgery, the external stitching which occurred to Matthew Eapen's skull?
Well, it was a continuation of what I just described, and basically just putting in a row of stitches through the skin to hold the edges of the skin together.
All right, this time I would forward 2 photographs to Your Honor with regard to the instability full photograph.
No objection, Mr. Check says so, they leave me on. It's marked as if it's 22 and 22. This is 22.
This is Exhibit 22. Dr. Madsen, do you recognize what's depicted in that photograph?
Yes, I do recognize this photograph.
And what do you recognize that photograph to depict?
I have been told this is a post-mortem photograph taken.
The question is, what do you recognize it as? What do you know?
I recognize that as the head of Matthew Eapen taken after death, a photograph taken after death of Matthew Eapen.
And that is not a photograph that you were present for.
That's correct.
But you do recognize what that is depicted in the
That is correct.
Thank you, Doctor. Exhibit 23. Were you present at the taking of this photograph, Doctor?
No, I was not.
Do you recognize what's depicted in the photograph?
Yes, this is a view from behind looking over the ear of Matthew Eapen after death.
And specifically, the area here, which I've illuminated.
The area, yes, that area is the back part of this question mark shaped incision that came down behind and then in front of his ear.
I don't know why.
Oh. And with reference to this photograph,
they probably turned it black because we're not supposed to see the pictures. Yeah.
Doctor, with the court's permission, could you please go to the monitor and show the ladies and gentlemen of the jury where the right occipital fracture to Matthew Eapen's head was located?
The fracture turned out to be present in the occipital bone, which is below a suture called the lambdoid suture, which I can, may I show that on the model?
Yeah.
As well. This model actually shows part of the lambdoid suture here, and the fracture which was seen was below that, and therefore was not present in the surgical area which I saw, which ended at this incision.
Doctor, use the word suture in this context. What does a suture mean in this context?
I should explain that because I've used it in two different meanings. A suture related to the bones of the skull means one of the lines which separate the different bones of the skull. And that's just the medical term. We also use the word suture to mean stitch. So when I say we sutured the wound closed, it means stitch, and they're unrelated usages.
And did you make observations in the area of Matthew's skull between where the surgery ended and where the fracture was located?
We could see the edge. You mean at the time of surgery?
Yes.
I could see the edge of the bone, and I did not see any sign of fracture in any part of the bone that I could see.
Between the areas of fracture and the area of the surgery?
Correct.
Thank you. Your Honor's permission to return these exhibits?
Yes.
Now, Doctor, after the surgery, was a decision made to perform another CAT scan?
Yes, it was. We went directly from the operating room to the CAT scan suite.
And was another CAT scan performed post-operative on Matthew?
Yes, it was.
Your Honor, may I approach Dr. Madison?
This guy's head is so big. Now I can't not see it. The great and powerful Oz.
And I ask you to recognize what's depicted in that imaging study.
I do recognize this.
What do you recognize that to be, sir?
This is the immediate post-operative CAT scan on Matthew Eapen.
Your Honor, may we have this imaging study marked as an exhibit?
Yes, the exit 24.
Your Honor, may I take exhibit 18 and exhibit 24 and put them on the view box to the doctor's right? Thank you. Now, with the court's permission, Doctor, I'd ask if you could step down from the witness stand and reference both Exhibit 18, which was the preoperative CAT scan, and Exhibit 24, which indicated a post-operative CAT scan, and indicate your findings to the ladies and gentlemen of the jury.
Yes, I can. The
Excuse me a moment. Can all the jurors see, if at any time somebody inadvertently blocks a view, just let us know, please. Go ahead, Doctor.
Thank you. The findings on the post-operative scan go along with what I saw directly at surgery. Namely, there is a large defect in the bone. If you follow this particular white circle around on each of these images, as I'm indicating, this is on the post-operative scan, you'll notice that there is an area where that particular white circle is missing. This is the right side in this area that I've indicated on the model and as the bone that was removed. There is a large amount of tissue that is swelling out through that opening. The characteristic markings of the edge of this tissue identify that it is brain. In other words, this is not just soft tissue swelling, this is actually brain tissue that has swollen out into that opening that has been made in the bone. The subdural hematoma, which indicating on Exhibit 18 here on, this is image number 7, that is present on many of them, is now gone, and that was what delivered itself and came out very quickly at the beginning part of the surgery. And in fact, that particular subdural hematoma is gone. The subarachnoid blood, which I had mentioned, which is more intimately on the surface of the brain below this layer, is visible as this white image, white marking here over the surface of the brain, and you can even make out the grooves in the surface of the brain.
Good Lord. Jesus. That scared me. His bark is terrifying. What? Buddy. Come here. Come on. Lay back down, dummy. You don't need to be doing that. What are you doing? Go lay down. You got all freaked out. You were nice and happy and cozy, and now you're just freaking out. He wants me to scratch his butt. Listen, go lay down now. Lay down. Take your nap. Dude, take your nap. Yeah, take a nap. Lay down. You're okay. Here, have a little meat snack and go lay down. Okay. Lay down. Oh, he's leaving the room. He's leaving us.
Are swollen. There is a new area of blood collection which corresponds to the space between the two hemispheres. There was a suggestion here which I did not point out yesterday because it was not something that initially I made very much of, but I think the radiologist.
Well, doctor, just testify, please.
Yes, sir. So that relative absence of blood is now replaced by a fairly thick clot of blood between the two hemispheres.
Excuse me, Your Honor, I think we should note this. Your doctor was pointing to Exhibit 18, Image 6, and then pointing to
Oh, whoops, I was muted again. Look at him in the corner. Look at him. Archie, come back in here. The chat paid for Doggo Cam, and they're supposed to get Doggo Cam. So come back in here. Come on. Come here. Dummy. Yeah, there you go. Come on. Lay down. Why don't you lay down? Lay down so we can see you on the camera. Good boy.
Exhibit 24, Image what?
Sit down.
6, 7, and 8.
Doctor, were there other findings that you made, given those two CAT scans, that were significant to your treatment and diagnosis of Matthew Weepin at that time?
Yes. We had succeeded in at least one thing, which is the lateralizing pressure, which had caused a shift of the midline of the brain, now seemed to be released. Even though there was still evidence of pressure and damage to the brain, the midline is now where it should be. And in fact, the ventricular system, which are these fluid-filled spaces, which were very small here on Exhibit 18, Image 8, are now large. And the overall impression is that they have gone from being compressed to being relieved.
Doctor, was a CAT scan performed on Matthew on February 6th?
Yes, it was.
Your Honor, may I approach the witness? Yes.
I want to get to the cross. But we probably shouldn't go for 3 hours today. I should probably call it quits. I do have to take...
I'll show you what appears to be an imaging study regarding Matthew Weepin.
I promised to take hangry sledding. Let's see. I can't scrub ahead. Like, it doesn't let me see how long it takes to get to cross.
Dated February 6th. Ask you if you recognize what that is.
This is an imaging study of Matthew Weepin on February 6th.
Your Honor, we have this imaging study. X marks. It's 25. Thank you. So publish this on U-Box. Yes. Thank you. Now, Doctor, similarly, if you could please step down with the court's permission and indicate for the ladies and gentlemen of the jury, 2 days later, what observations you made of Matthew Weepin's head and brain that were significant to your continued treatment and diagnosis of Matthew.
Yes, I can. The major findings which I pointed out to contrast the immediate pre-op and immediate post-op scans of Matthew are really unchanged. There's still a large defect in bone. The midline shift is resolved, and there is still evidence of very significant swelling in the brain. The new findings, which can be now understood, I think, in this progression, is that there are large areas of the brain which show a lower density. That is, the grayness that the CAT scan machine assigns to them in this image is a darker color of gray on the right side relative to the left side here on Exhibit 25, Image 9, let's say, but present in most of them. And at this stage in our treatment, one of the most important questions was what the ultimate prognosis was going to be for Matthew. It was clear that we were seeing areas of very severe brain damage and probably infarction, in other words, stroke or complete death of that brain tissue. Certainly on the right side, but there were also clear indicators of problems on the left side as well. And the point that I was trying to make yesterday on the loss of the gray-white junction on the very early scans, here I'm pointing to Exhibit 18, Image 8, that we were seeing some blurring of the gray-white distinction already then. I think the members of the jury can see this really playing out in its full expression on the later images, such as here on Exhibit 24, Image 8, where you really can't see any distinction between the gray and white matter. And this is on the left side, the side that was the less injured side. and the same ends up holding true on this scan of February 6th. That's Exhibit 28, number image 8. In addition, we were beginning at that point to see areas of low density in the midst of the brainstem, which on this particular image is this region. If that's not clear, we can show it on the telesensor. I think it probably is clear, but it's right in the middle of the brain. That structure that I showed in the model is the stem coming out, and we were beginning to see signs of brainstem damage as well.
Could you just tell us what image number that is?
That would be image. I was pointing to number 7 on Exhibit 25, but again, it's present on several.
Your Honor, with Your Honor's permission, I'd like to remove the last exhibit. Removing Exhibit 25 from the view box.
It looks like that guy's brain is popping out of his head. The neurosurgeon. It looks like it's swelling from the side. He looks like it's swelling over his. It's just so strange how these people look like what they do.
Doctor, was a CAT scan performed on Matthew Weepin?
Well, we need the view box anymore for the council to go back.
I'm, with the court permission, I'm going to place one final CAT scan on the view box.
It's not, placing it.
Doctor, was a CAT scan performed on Matthew Weepin on February 8th of that week?
I believe it was, yes.
Doctor, I'd like to play you a CAT scan imaging study and ask you if you recognize what's depicted in that CAT scan.
Yes, this is the February 8 CAT scan on Matthew Weepin.
And whether or not that was the final CAT scan taken of Matthew Weepin.
I'm starting to get very tired of the CAT scans. I wonder if the jury feels the same.
It was, yes.
Like, what are we trying to prove with these? We get you did surgery, you took away the bone, the brain was swelling. We can see the pre-surgery CAT scans and the post-surgery CAT scans. Like, what else is there to know?
Brandon, we have this CAT scan marked as an exhibit.
Yes. 26, is it?
Yes.
That's why I want to get to the cross. I want to get to the cross because this just tells me nothing. Like, this prosecutor is not good at setting up his case. I don't know what he's trying to tell me other than the facts of what happened in the surgery. Why is this important? We need to speed this up.
Similarly, I ask you, with the court's permission, if you could step to the view box and indicate findings you made that were significant to your treatment and diagnosis of Matthew Weepin 4 days after he was admitted to Children's Hospital.
Yes, I can. What we saw at this point in the CAT scan is continued progression of the process, which we had really seen from the February 4th onward. But here, I think it will be clear in comparison with the other scans, particularly how now not only is the entire left hemisphere involved with this process that has made the brain go very dark on the scan, but also now the left side of the brain is similarly showing that change. So the process involved seems to be the same by these scans, but happened at a rapid rate on the right and a slower rate.
Basically, you removed the skull and the brain started escaping. And these CAT scans look terrible. Looks really scary.
On the left, but the left is catching up here.
Oh, how much longer is this? I need the cross. I'm sorry. I have to skip. I do not have the patience of Jeff. I do not. Jeff had patience. I do not. Prosecutor, still prosecutor. Who's asking the questions now? Oh my God, how much longer does this go on?
I do have an opinion, yes.
What is your opinion?
I think they would have most likely occurred in relation to each other.
Similarly, do you
All right, we have to go back and listen to this, unfortunately. Oh, God. Sorry, folks.
subsequent progression of those injuries that you've just tested?
Fluctuations.
Weeping. Did you form an opinion to a reasonable degree of medical certainty whether his brain functions were progressing or worsening?
The
question wants to know whether you have.
yes.
And what was your opinion, Doctor?
About what was actually happening with his.
The question is, do you have an opinion as to whether he was improving?
The opinion was that he had fluctuations neurologically from day to day, which were very slight, but his overall neurological status was very devastated.
And at some point during your treatment and diagnosis of Matthew Weepin, did you form an opinion to a reasonable degree of medical certainty whether the brain damage was reversible?
We felt this damage was not reversible.
Now, Doctor, given Matthew's injuries that you observed to be present upon his admission to Children's Hospital on February 4th, and the subsequent progression of those injuries that you've just testified about and that were observed throughout the week, I have some questions regarding your opinion as to potential causes of those injuries, manner of infliction, and degree of force necessary to cause these injuries. Doctor, based on your observations of Matthew Weepin, your review of his medical records, your review of the relevant literature in the field of pediatric neurosurgery, and your training and experience in that area. Sir, do you have an opinion to a reasonable degree of medical certainty whether a gentle shaking at approximately 2:45 p.m. on February 4th to arouse Matthew because he appeared sick and unresponsive would have caused Matthew's brain and skull injuries that were observed to be present upon his admission to Children's Hospital?
I do have an opinion.
What's your opinion, Doctor?
I believe that would not explain the injuries.
Doctor, do you have an opinion to a reasonable degree of medical certainty whether Matthew being tossed onto a bed on February 4th prior to his admission to Children's Hospital would have caused Matthew's brain and skull injuries that were observed to be present upon his admission to Children's Hospital?
Objection, Your Honor.
Basis in the record for that.
I'm sorry?
Objection, no basis on in the record for the hypothetical about the toss onto the bed.
All right.
Would you like me to repeat the question, Doctor, or do you recall the question?
Yes, if you could repeat it.
Doctor, do you have an opinion to a reasonable degree of medical certainty whether Matthew being tossed onto a bed on February 4th prior to his admission at Children's Hospital would have caused Matthew's brain and skull injuries that you observed to be present upon his admission to Children's Hospital on February 4th?
That would depend on the toss.
All right, that's the answer.
And do you have an opinion as to what type of force would have to accompany that toss to explain the injuries that Matthew had when he arrived at Children's Hospital?
Yes, well, I think that this is more than what would come with an ordinary fall, if that's what you would mean.
Do you have an opinion to a reasonable degree of medical certainty whether Matthew being dropped onto towels covering a tile bathroom floor on February 4th of 1997 would have caused Matthew's brain and skull injuries that were observed to be present upon his admission to Children's Hospital on that day?
Same objections before, Your Honor.
Same objection.
Objection about the nature of the hypothetical, the factual basis, that's all. I know you're going to make the same
What I hear you
ruling.
saying is you're objecting because the height of the fall isn't specified in the question.
No,
You're not saying.
No, I'm,
Oh, in that case,
my
the
objection
objection's overruled.
I knew it would be, because you made the previous ruling, I'm just making it. For the
What's
record.
with the flowers? What's with the flowers on the judge's desk? Like, who gave him flowers? What are those there for? I mean, they're nice and cheery, I guess, but what?
unduly interrupted.
Where'd the dog go?
My same objection to that.
He moved into the kitchen.
No foundation.
Very well, I take it on the grounds you offer. and
His
I'm open.
butt is here,
Doctor,
I'll
would
show
you like me to
you.
repeat the question?
He's right there.
Yes, may I ask you a clarification on the question? Okay,
He's
you
in
may
the
repeat the
kitchen.
We
question.
have a procedure here that's been followed for about 300 years. The lawyer asks the questions.
Yes, sir.
Come back here.
Doctor, do you have an opinion to a reasonable
Yeah.
degree of medical certainty
Hey,
whether Matthew being dropped onto towels covering a tile bathroom floor on February 4th of 1997 would have caused Matthew's brain and skull injuries that were observed to be present upon his admission to Children's Hospital on that day?
I do have an opinion.
What is your opinion?
I believe that would not count for the injuries.
And doctor, I ask you to assume that on February 3rd of 1997, Matthew was seated on or near the steps leading to the indoor playroom of his Newton home. He fell over, impacting his head with the stairs.
ooh.
Do you have an opinion to a reasonable degree of medical certainty whether that would have caused Matthew's brain and skull injuries that were observed to be present upon his admission to Children's Hospital on February 4th?
Yes, I do.
What is your opinion,
I
doctor?
believe that would not explain the injuries.
Why not? Are you going to ask him why? I really can't wait for the cross on this. But we're going to have to get to that next time. I don't think we're even going to get through this because I need to get ready to take Hangry to the sledding hill. We have a brand new sled and it is his break. So I promised that we would go sledding and it's finally above 16 degrees in New York. So that is what I am going to do. Thank you so much for hanging out with me today, you guys, and thanks for all the good dog treats and everything else. We will be back to do this again next week. I don't know what day. Just stay tuned. If you're following me on Locals, meganfox.locals.com, I always put up when my streams are going to be there, and I'm going to try and plan this the day before and have it up on, ready to go so you guys can see when it is. But it's been a really fun day. Thank you for coming back. Sorry I missed last week, but I had sick kids, so it was a whole thing. So thanks for hanging out and for giving Archie all those wonderful treats. He had a really good day. And let's see, who should I send you to? I think Nick Starro has Mo in the deep end. They're talking Delphi, I think. Let me see if they're still on. Because I had invited Mo, but she was going on with Nick to do Delphi stuff. So let me see. Maybe I can send you over there. Yep, they're still live. So let's send you over to Nick and Mo, and you guys go talk about that. Go talk about that some. Okay, here we go. What am I going to leave you with today? Do we need to have a song? Let's just do we'll do the old outro, shall we? Where is it? It's missing. No, not that one. Not that one. Where did it go? Ah, there it is. See ya.
I was so lost, my world is near its end. I almost felt my head is full of a million choices. I am alive, I'm not here to pretend. I love my friends, my heart is filled with a million voices. Oh, this road has many choices. Oh, and my heart, million voices. Come next to me, my friend, embrace the sky. I'm not afraid to fly. It's not the time to say goodbye. I don't wanna say goodbye.